Okay, so this is my patient, Miss Weaver, who is a wonderful person, and she underwent cataract surgery in the left eye. She had monovision before, and so the left eye was going to be her near vision eye. And so even though the surgery went perfectly well, she noticed a very disturbing problem, and that was that her vision was blurry, but also she had this dark shadow on the side of the vision. And this is called negative dysphotopsia, that we discuss this in great detail because a lot of people may not know that this is a problem that can happen to quite a few patients despite perfect surgery. But a small percentage of patients are like Miss Weaver, where the symptoms wouldn't get better and they persisted. Again, most people with negative dysphotopsia get better over time, but that did not happen to Miss Weaver, and we did her surgery, what, like last year? Yeah, and she waited a long time.
Yeah, it was over a year.
And so she finally developed such a big cataract in the other eye, she went ahead and let me do it, even though she was nervous. But I told her that I was going to do the surgery a little bit differently and put the implant in a different position because I am trained to do this slightly different technique, and I want you to share with us the problems that you had with the first eye, what we did with the right eye, and how things got better.
Yeah, well, I had the cataract on the left eye that had done first, and I thought that's going to be great because I've always used to wearing, bifocals for close-up and out. But when we did this, it was like I kept seeing a shadow right under here. Even when I would look, like left or right, I couldn't see my left as much. And I kept trying to explain it. I thought, well, maybe it's just me. So I was scared about doing the right eye because I wasn't really happy with the left eye. So then finally, I trusted Dr. Kim, and I went ahead and had the right eye done, and then kept telling him about the left eye. So we talked about it. So he said he would redo whatever he did. Anyway, it is wonderful. I mean, I'm not nervous driving now. Before, I wasn't sure because I wasn't sure with this little shadow right here. But now I'm very satisfied with it. I'm doing good. I even hugged his neck.
Now, as far as the right eye, that eye was a distance eye, correct?
Yes.
And so I think you're 20/20 now in the right eye. Perfect.
Yeah.
And then the left one is your near eye, and now you're able to see up close. And so now, because of that, you're not even wearing any glasses. Is that right?
No.
And that visual problem that you had is now gone.
Yeah. I'm doing good. Yeah,
great.
Good.
So I'm thankful that you shared this with us, Ms. Weaver, because there might be other people out there who are hearing this saying, hey, I have the same problem.
Yeah, well, I mean, I thought, well, maybe it is me. Maybe it's my nerves, or maybe it's my age, or maybe it's, I just had all kinds of things. But I kept seeing it. I know that something's not right. So.
Right, and that's called negative dysphotopsia. Okay. Again, fairly common, even despite perfect surgery. And again, this has to do with the implant lens and the fact that it's just not the natural lens in our eye that we had before.
Yeah.
And so it's just a side effect of that. And so other people might hear this and say, hey, I have the same problem.
Yeah.
And other doctors may just tell the patient there's nothing you can do about it.
Yeah. But
thankfully, you had this surgery and we changed it and did it something a little different, and we were able to fix it. So I'm glad that you were able to share your story.
Well, that was what I was scared of, because I thought, if I've had it done, you can't do nothing about it once you have it done. That's it.
Right.
So I'm thinking, well, I'm going to live with it. So I've got to make, I'm got to try. But I kept trying. I thought, something's not right. But, thank goodness Dr. Kim, he heard my cry.
Right. And that's the thing. I mean, most time you don't want to have it done redone.
Yeah. Oh, okay.
But as you know, we went ahead and took your lens out.
Okay. That was scary.
And it sounds scary, but we took it out and it was fine.
Okay.
And then we put a new one in. And that's because I have experience taking out lenses when they need to be taken out.
Okay.
And it can be done. Of course, you never want to do it if you don't have to.
Yeah.
But thankfully, in your case, it went great.
Okay. And I'm thankful too. Thank you.
Thank you, Ms. Weaver. I appreciate you sharing your story.
You're welcome.